Hi, my name is Adriel William, and in today's video, I'm going to discuss with you an ethical scenario which is based on patient confidentiality and is asked in a lot of interviews. And recently, I had a candidate that I worked with, and she got this question where the interviewer asked, if you have a patient who's HIV positive but have not informed their spouse who is sitting outside, what would you do in this case? And the candidate said, well, if the patient is HIV positive and have not informed their spouse, maybe I would counsel them. I would encourage them to talk to a counselor, talk to their family. But on a personal level, I can't give away their health history to anybody because it would be a violation of HIPAA. It would be a violation of patient confidentiality. After she said that, the interviewer said, what if the spouse is also your patient? Will you inform them in the separate room? And she said, no, I still can't do it. It's a violation of HIPAA. And then the interviewer said, well, you're a very cold hearted person, then you will let the patient spouse die of this deadly sin. But the good thing was that the candidate remained persistent and said that we can't violate HIPAA and give away patient confidentiality. And that's a good thing. That's how you're supposed to answer whenever they ask you a question regarding patient confidentiality and their history detail of health. But I'm going to explain to you a little bit more regarding such scenarios that can be asked in different wordings. One thing I want to let you know that right now, currently in US, whether it's big dental clinics, whether it's hospitals, whether it's healthcare system, whether it's dental schools right now, all of their systems get cyber attacks, which means like hackers try to invade their system all the time. Like when you will get accepted to a dental school, the first thing that will happen in your orientation is the dental school is gonna ask you to download like series of softwares on your laptop, and it will have a firewall and it will protect everything that you will open up on your software or on your computer. The reason they do it is because if any patient data in United States is stolen, it can be used on dark web, it can be used in negative ways, and then that person, for example, if my detail is lost by my bank, by my dentist, by my hospital, and somebody steals money out of my bank account, I can sue my bank, or I can sue my hospital, or I can sue my dentist for losing my data. So for dental schools, it's a lot of responsibility. For any big organization, it's a lot of responsibility when it comes to patient confidentiality. So in a lot of interviews, they will give you scenario that uh, you were working in a hospital and you went into an elevator and you heard two nurses discussing the detail of a patient or something personal of the patient. What will you do? In this kind of scenario, you will talk to your colleagues, to the nurses, that we are not allowed to discuss patient detail outside their room or without their consent, and this is a violation of HIPAA. And if you continue to do this, I would have to report you to the supervisor, because if this is an ongoing thing, this is a breach of HIPAA and can create problem for the patient and for the staff. Now, this is a second scenario. The third scenario, I was asked question in USC MMI that you have a patient, you have a office manager who comes to you in the morning and informs you that she took a USB stick that had all the detail of patient data, like all the patients in your clinic, and she lost the USB. What will you do? My answer in that MMI/PIDA talent assessment was that if this happens, I will try to look for the USB with her. If we can find it, we'll try to retrieve it. If we can't, we will inform the concerning authority, the government, about this breach or we lost the data. Thirdly, we will inform our patient that there's a potential chance of breach of data. If anything happens, you can reach out to us so we can reimburse or help you out in this situation. And the fourth thing is I'll set up a meeting with my staff and I would like to talk to them that why was this data taken out of the office in the first place? Why was this happening? And this is a discussion I would like to have with them. And this is how I answered this. And the reason they put this question in the interview is because now I'm practicing as a dentist and I get to hear this story where an office manager was stealing the patient data and selling it to somebody on the dark web or something like that. And then the FBI came to the clinic and asked the dentist about what's going on in your office. So these kind of scenarios happen. The reason I'm telling you all of these stories is because as an immigrant, as a student, maybe we are not aware, but in US, losing a patient's data or losing patient's confidential any records is a very big violation, and it can cause millions of dollars of lawsuit. So in dentist school interview, they are not so much worried about teaching you class 2 because they know they can. They've been doing it for years, and they already know as a foreign trained dentist you can do class 2s. But they are much more worried and concerned that will you be able to understand? Are you malleable? Are you smart enough to understand the importance of HIPAA and patient confidentiality? Because as a dentist, as a dentist student, as a practitioner, if you're not aware of this and you're not cautious and careful about this, you can cause a lot of damage to your patient, to the whole system, to the institution. So that's why, in one way or another, they will ask you some question where they will say that there was patient's history, there was something regarding patient's data, and if it's not secure, what will you do? Or if there's some kind of breach, what will you do? Somebody left a piece of paper with the patient's detail on your desk, what will you do? Or somebody left their password. And these kind of questions you will see in Kira and Casper in personal one-on-one interviews. And through this video, what I'm trying to explain to you, regardless of what the scenario might be, regardless how they frame the story, but if you look the underneath value or the point they are trying to figure out is that do you know the importance of patient confidentiality? Do you understand why patient confidentiality and HIPAA is so important in the United States? And if you say, yes, I do understand, and I will make sure that I will protect the patient's data at all costs, and if I see somebody breaching it or violating it, I will inform the concerning authority right away. And if you answer these questions in this manner, the school will find you as a much more, uh, I would say, useful student. They will consider you as somebody who understands the problems of the given society, you understand the intricacies of the healthcare system, and you can be a good dentist student in the future. So I hope this video makes sense to you and you would be able to use patient confidentiality scenarios to answer your interview better and perform better. And if you have any questions or regarding this, you can write in the comment. If you're interested to get a one-on-one session for your interview preparation for any dental school, you can reach out to me through WhatsApp or through Instagram. It should be in my description. And if you like this video, do hit the like button. It means a lot to me. It gives me the encouragement to make more videos like this. And I hope to see you in a more meaningful video. Thank you.